My name is Baraka. Call me Musimu, just in full. And I'm a fellow in CHESA, which I started last year in June. And so I'm kind of now proceeding with fellowship, where we have also the project that we are entitled to do as a fellow in this fellowship. And my project is solely looking into the prevalence and the predictive factors for depression, anxiety among patients diagnosed with head and neck malignancies at 3 tertiary hospitals in Tanzania. That is Muhimbili National Hospital, Ocean Road Cancer Institute, and Bugando Medical Center. Well, so back then when I was born those years, my grandpa was also a medical doctor, so he used to encourage me and always he took me to the hospital I was working. And so that kind of always he used to tell me, okay, Baraka, you need also to come and be a doctor. And part also my parents used to push me and encourage me to become a doctor. So I was like, yes, I think I need to be like my grandpa and become a doctor. So I kept working hard until then I managed to become a medical doctor. And for the fellowship, specific in research, when I was doing my undergraduate studies, I had a very close friend of mine, and all of a sudden he started being sick. We took him to hospital, and surprisingly, when the doctor did examination, they told that he had cancer, and they could not live long. He passed away. But that thing for me was very traumatic in terms of psychology. And then I was like, I think being a doctor for me is not enough. My friend has just gone. Can I do more probably to understand and to know more about cancer? And probably if possible I can do something for others. That was the initial thinking that came in me when I thought about him. So I went for it, and then I went like, I need to do something with cancer. So I started reading through the articles, information, and then when I came back now for my residence, there was this information, the advertisement at the university regarding the Global Cancer Training Program for residents. I applied, and then I get one. So from there now I started doing my training as a mentee for cancer research program. That is in a collaboration with Muhimbili University of Health and Life Sciences, Ocean Road Cancer Institute, and University of California. So I worked on the cell malignancies, where I was looking into the risk factors. I was also looking for the histological types, the clinical stage, and different treatment modalities that are being carried out for this kind of patient. And then I did it successfully, and in fact I was awarded the best abstract for my work during the scientific conference of the university. So from then I would also be assigned to an external mentor who is from USSF, that is Dr. Mary Zhu, if you can happen to know her. So she has also played a great role, especially in taking me to where I am today. So she kept pushing me, Baraka, you are done with this one, there is this also you can try. So then I saw now the advertisement from CHESA, and then I applied. Luckily enough, I got in there I am today. So if that role comes to me, I think first of all I would like is to encourage. First of all, you need to sensitize people all around who are about to work with me or they are ready to work with me, to sensitize them about what we need to do, head and neck cancers, what is the problem and the gap in our context, and so what we need to work on so that we can help this group of people who are affected by this kind of diseases, and then to encourage them that yes, we need to do this to help these people and they improve their lives, improve their quality of life, improve their psychological thinking, and whatever they are looking for in their life despite that they are sick. That is what has been very much pushing me and making me to think like, yes, I need to do something for this group of people to help them. You know, when talking of head and neck cancer patients, they are being affected with a lot of things around. The disease itself, on the location where it happens, sometimes it affects their physical appearance, disfigurement. Some of them, they lose speech ability. Some of them, they can't even sense of smell has been lost, and some of them even they can't even speak up. So a lot of challenges affect this kind of patient, and sometimes we are not doing much to help them, especially in our area. That's why I'm so interested. If I have that to happen that hour, yeah, I think you can do something much good to help them. Well, I think I will advise everyone who is interested in joining the fellowship, and specifically learning, because in fellowship it's about learning. Yes. So if somebody is interested in joining the fellowship, I will encourage him or her to join the fellowship. There are a lot of things that we are getting, we as a fellow in this kind of fellowship. Like for me, when I started the fellowship, yes, I was like a kid who is now trying to stand, but he's still struggling. Now I can stand and I can walk. That's incredible that the fellowship has done for me throughout the time that I've been doing my fellowship. So I will encourage everyone to come and join the fellowship. There are a lot of things that is going to get in terms of training, getting skills, knowledge, and also the expertise on how to do research, on how to improve your work in your area, aiming to improve the lives and also the lives of people, especially those who are vulnerable and they can't have an access or they can't get good health services. You learn here on how you can also do and improve. Like the question you asked me, if I happen to get a law to lead such a thing. So that's what we are getting, we are learning in fellowship. Not only that you get to learn about the research, but there are more things that we are learning altogether, just to equip us with abilities, experiences, and the skills on how we can lead and change lives of people where we are living. So I encourage them to. Thank you.